My name's Frank Buttacavoli. My specialty is hip and knee reconstruction. The majority of what I do involves hip and knee replacements and revisions of replacements gone bad. Throughout high school and college, I spent too much time in an orthopedics office as a patient, but it did foster my interest in orthopedic surgery, and I went to medical school with a specific interest in becoming an orthopedic surgeon. I treat a variety of patients, but we can get similar outcomes irregardless of age. The younger patients that I evaluate for hip and knee replacements usually have congenital deformities or things that they were born with that led them to the need for an early joint replacement. The most common patient I see is that person in their late 60s that the parts have worn out, and it's the main reason I have a job. The parts do wear out, and run-of-the-mill arthritis is the most common thing I treat, and patients that are good candidates for surgery do very well with hip or knee replacements. At an academic center like ours, we have a fully integrated system that where from preoperatively to postoperatively, there's no hiccups in the care for our patients. We have a very specific program that we follow, and our patients do very well because of that developed program. At our institution, we're interested in having happier patients. We want our patients to have better outcomes. We are doing research on implant survivability as well as new implants. We also have an interest in finding non-operative ways to treat patients. The stem cell research is still early in its infancy, but we do hope that there's a future for that for the treatment of hip and knee arthritis. I specifically had a big interest in hip and knee reconstruction because of the predictable outcomes. There is a sense of instant gratification because we return people back to a better quality of life. What I love about the procedures that I do is not only do I stop their pain, but I get them back to a level of function that they were long before they met me.